As staff near their breaking point, hospitals in Windsor-Essex come together with an urgent plea. They want the public to take COVID more seriously before it's too late. Students will be back at this school Monday, 2 weeks after an outbreak closed its doors. We'll tell you what the school's done to prepare. A live look outside tonight as we take a quick look at the weather. Slight chance of rain that could turn into flurries tonight. It's going to dip to -6 with the wind chill early tomorrow morning. Colette Kennedy joins us tonight with a full look at the weekend's forecast. I'm Chris Hensing. Thanks for joining us. Windsor and Essex County will not be entering a lockdown. Not yet. The health unit says they need more time to see if the current red zone restrictions can help slow the rapid spread of COVID-19. Today, hospitals in our region are sounding the alarm over the surge in cases. More than 60 announced today. The CBC's Katerina Georgieva is live at Windsor Regional. Kat, what's the situation inside that hospital behind you tonight?
Well, Chris, at Windsor Regional, we know that the ICU is already at capacity, but the message that we're hearing from all of the hospitals in the region is that this spike in cases that we are seeing, it is posing a serious threat to the entire system. Bed capacity is under threat. The ability to perform elective surgeries is under threat, and it's gotten so severe that the hospitals are pleading directly to the public, asking them to take action now so that we can avoid a worst-case scenario. In a joint memo, a plea from the region's 3 hospitals. Our healthcare system is facing extremely serious strain, and the public's urgent help is required. Not mincing words, it goes on to say, the scenario that our Windsor-Essex region residents have seen on TV taking place in other jurisdictions around the world, where hospital resources are stretched beyond capacity, is showing signs of occurring in our area of the province. All this as Windsor's 2 hospitals are dealing with COVID outbreaks. The CEO of Erie Shores says this is a call to arms for people to step up.
We are nervous around what the upcoming weeks look like. We are in red status, but we know that many individuals may not necessarily be adhering to the strict guidelines that have been set out by public health and Dr. Ahmed. We need those individuals to take action. Everyone impacts someone's life at this point in time.
Occupancy is tight across the board. Between the 3 hospitals, there are 23 COVID-positive patients, with 9 in critical care at ICUs. Erie Shores says it has a dozen in hospital with either confirmed or suspected COVID.
Although that number may seem small, it has doubled over the last several days, and we are anticipating that over the upcoming days, it will continue to rise.
Officials want to avoid a worst-case scenario. The pressure of it all hitting those on the front lines.
To see a second wave coming right now and feeling the impact again is becoming draining.
Wilson is a manager in the emergency department. Because she's pregnant, she doesn't enter COVID rooms, but sees the toll it's taking on staff who bond with the patients.
Seeing them take a turn towards the worst, where they end up potentially in ICU, is definitely exhausting on all ends, and put some mental drain on both staff and patients involved, because we want to make sure we support the patient's mental health, because sometimes they feel quite alone, which unfortunately at this point they are.
She worries things might get worse and urges everyone to follow health guidelines, especially with the holidays around the corner and officials asking people to celebrate in their own homes.
We get it. We're going to miss our families too. We don't want to lose those experiences. But I think it's important just to remember that this is temporary, even though it is long, but it is temporary. And if we do the right things, the less damage, the better. And then hopefully you'll have your families for future Christmases and things to come.
A pretty personal call to action there for members of the public, but hospitals themselves, what are they doing to avoid that breaking point?
Well, we know that patients from Windsor, some of them are being diverted to Erie Shores right now. And then if things continue the way that they've been going, then patients will likely also be diverted to Chatham from there. And then the next steps would be canceling scheduled surgeries and procedures in order to make space for emergencies. We also know that the province has provided 30 additional beds for the region to deal with all of this. But the stress continues to be on the community, that it is time for the public to continue following the regulations and really take all of this seriously, because as one healthcare worker told me, it's scary not knowing how bad this could get, but they don't want to find out. Chris.
Thanks, Jessica. The CBC's Katerina Georgieva live tonight. Now, the health unit gets a little deeper into the pandemic numbers on Fridays. It gives a better sense of where the spread of COVID-19 is happening and who's at risk. What you're looking at right now is how people were exposed to COVID-19 in November, the three largest categories. 42% of cases spread through close contacts. Household contacts are a big part of that. Dr. Ahmed saying that once one person is infected, they pretty much infect everyone else in the house. Outbreaks, the other big cause of transmission, 25% of cases in November related to those. Community transmission is next. Close to a quarter of cases in November where the health unit does not know how the person was infected. That's the community spread, another term for that. Dr. Ahmed says that's quite significant. We got another graph here. This time it's going to show you the COVID-19 cases by age. And this is just for the last 2 weeks to get a sense of what we're seeing now compared to overall. People 20 to 59 years old make up most of the cases in the last 2 weeks. That pairs with what we've seen for most of the pandemic. The shift we're seeing, though, is that in the last 2 weeks, the youngest and oldest people in Windsor-Essex are making up a higher percentage of the caseload. 19 and younger, 21% of cases in the last 2 weeks. 60 and older, 19% of our cases. Developing story here tonight. One of the 3 schools in Windsor-Essex County with a COVID-19 outbreak will be reopening their doors. W.J. Langlois Catholic Elementary School got the go-ahead from the health unit to start in-person learning once again on Monday. Its principal says it's had a thorough plan in place to reopen safely.
I'm confident in what our staff was doing. We were following the guidelines of our provincial guidelines as well as our local health unit. And even Dr. Ahmed indicated that, he's confident with what we were doing in our school. That being said, we always revisit our protocol, right? There's always room for having conversations and making sure that we're still adhering to all of the measures taking place.
Now, the school was closed on November 20th after the outbreak was declared. In all, the school saw 7 positive cases of COVID-19. 3 were staff members, 4 were students. There are 252 students at the school that will be heading back for face-to-face learning. 140 who had opted for online learning will continue in that stream. The health unit will be providing a nurse for students on site starting Monday. And the school board also says that it's completed a thorough cleaning and sanitization of the entire school. A Windsor mom thinks that the lockdown during the first wave delayed her son's cancer diagnosis. She says that his disease might have been caught earlier if it weren't for the pandemic. As the CBC's Jennifer Lagrassa reports, it's part of a trend across the province that has some health officials alarmed.
In September, time was of the essence for Donna Girardi's adult son. The 28-year-old was diagnosed with stage 3 germ cell cancer after 4 tumors were found throughout his body. Though he began experiencing symptoms in December of 2019, at first he was misdiagnosed. And when COVID-19 began, he couldn't get in to see his doctor. All of this led to a late-stage diagnosis, possibly complicating his treatment. He didn't want to comment on this story as he's focused on his recovery, but his mom wants to speak out as she's worried there may be others affected by the closures in the first wave.
When he tried over and over again to try and seek more professional help, it wasn't available. I think the government needs to learn you can't play with people's lives. You had to keep some of the things opened and give people access to certain things.
One patient advocate that I spoke with says what Girardi's son experienced is all too common. Some doctors only saw patients virtually back in March, meaning patients were left without in-person appointments. Fear of COVID-19 also meant that some patients were afraid to come here to the ER. And across the province, some cancer screenings were cancelled altogether. This led to an increase in late-stage diagnoses. Though that wasn't the case at Windsor Regional Hospital's Cancer Centre, officials say they are concerned, as a drop in referrals for radiation and chemotherapy treatments means there could be cases missed.
We do look at what we've seen in other parts of the province, and we're very, we look at that and we prepare for that. There is that population of the unknown that have not been screened, who have not arrived at primary care yet. And we'll have to wait and see what that looks like in the near future.
And while Girardi's son is already a few months into his treatment, she says he still has a long way to go. Jennifer Lagrassa, CBC News, Windsor.
And the number of COVID-19 cases in Canada has topped 400,000. Today, the country's top doctor released new details about who will be eligible to receive the first doses of the vaccine once it starts arriving. Dr. Teresa Tam says the National Advisory Committee on Immunization has identified 4 groups.
Initial doses of authorized COVID-19 vaccines should be offered to residents and staff of congregate living settings that provide care for seniors, adults 70 years of age and older, beginning with adults 80 years of age and older, healthcare workers, including all those who work in healthcare settings, and personal support workers whose work involves direct contact with patients, adults in Indigenous communities where infection can have disproportionate consequences.
Now, health officials expect to get 6 million doses of vaccine during the first quarter of 2021. The procurement minister also announced that Ottawa has purchased enough needles and other supplies to provide 25 million injections. And we now know the names of the people who will help oversee the COVID-19 vaccine distribution here in Ontario, but there's questions being raised tonight about who's not part of that group. Lorenda Redikoff has the details.
The first meeting for a task force with a huge challenge, sorting out logistics to make sure any Ontarians who want a COVID-19 vaccine get it. The head of the task force met his new team over the phone.
Let me just also say how intimidated I am. I look at the list of names.
Some of those names, infectious diseases expert Dr. Isaac Bogosh, Toronto's former police chief Mark Saunders, and an Indigenous chief, Roseanne Archibald.
Giving people hope, getting the economy back up and running again, getting people's lives back to normal.
And in this next months, and it'll be quite a few months, help bring Ontario back to what we view as a normal lifestyle.
The group also includes a trauma surgeon, a doctor from a children's hospital, and a bioethicist.
I'm a bit worried about who I don't actually see on the task force and the voices that I think need to be there.
He says while older people make up 97% of COVID-19 deaths, there's no one representing long-term care. And there are still questions about how seniors with complex conditions might respond to the vaccine.
How do we make sure that we are getting these vaccinations effectively to our older populations, whether they be in long-term care or other settings, and understanding the potential issues that could happen with vaccinations in older adults? That concerns me.
This long-term care advocate and researcher sees another possible issue.
There may be a missed opportunity to include public health, because we know every year public health rolls out a mass vaccine program in long-term care. So they have clear expertise doing this already. So the other question is, are they going to be involved?
New task force member Dr. Bogosh says one of his goals is including those most affected by this virus.
We know various communities are disproportionately impacted, and I really want to have broad representation of those communities because they need a voice, and their voices have to be heard and have to be integrated into these plans.
Critics note there's also no vaccination expert on the task force. They hope the team will reach out to people like this to ensure that as many people in Ontario will be vaccinated to reach herd immunity as quickly as possible. Lorenda Redikoff, CBC News, Toronto.
As a big part about this is going to be those freezers, how they store the vaccine. Windsor Regional Hospital secured 7 freezers to help. 3 of them will be set to minus 80 degrees Celsius. That's the temperature needed to store Pfizer's vaccine. The other 4 are set to minus 25 for Moderna's vaccine. Altogether, they can hold about 1.7 million doses. Ontario landlords were told by the province to freeze rent in 2021, but renters in Windsor are still being told that rent is going to go up. The CBC's Tamina Aziz reports.
When Amanda Yunin was told her rent was rising, she contacted her property management company and informed it of the rent increase.
Basically, because we moved in here before the rental crisis and we pay a decent amount of rent, they feel we should be paying more. And I don't think that's right.
The provincial government says it passed a bill in October which will freeze rents at 2020 levels. So the vast majority of tenants will not face an increase in 2021. Yunin pays $900 a month. She says her rent would increase by 1.5%, making her rent about $913 a month instead.
I know it's not a lot, but it's just the principle of following the rules. Like if everyone else has to, they should have to as well.
Windsor West MPP Litsa Gretzky says this predicament is common and says tenants need to learn their rights.
We've had many constituents who have had the same issue where they're being issued a notice saying that their increase will take effect 2021, and that's just not valid.
A lawyer in Windsor has also had clients facing the same dilemma and urges people to talk to their landlords about the rent freeze.
Maybe the landlord's not aware that this freeze has happened, and just communicate that she's not going to be paying that rent increase, that those aren't allowed until January 2022.
CBC News reached out to the landlord and she told us the notice might have been sent by mistake, but Yunin has never been told that. She says the company hasn't spoken to her about it despite several back and forth messages about the increase. She hopes by sharing her story, others won't be taken advantage of. Tamina Aziz, CBC News, Windsor.
A lot of news you can use there. You can go online to our website to find more about that story, cbc.ca/Windsor. The freighter that was stuck in the Detroit River has been moved. Traffic on the river getting back to normal there. Tugboats helped get the Harvest Spirit to safe anchorage after it was refloated. The Canadian Coast Guard says the vessel will now undergo further inspection to make sure that it wasn't damaged. The ship ran aground near Boblo Island in Amherstburg on Wednesday. According to Windsor's harbor master, it was stuck right on the border, one half of its hull in Canada, the other in the United States. A look outside here, a bit of the river and the downtown core. Not as much snow on the ground as there was at the start of the week. Colette Kennedy will tell us what we should expect as the weekend comes along. Plus, it is that time of the year. A lot of folks out getting the perfect Christmas tree, but there might be more pressure this year. The pandemic has people moving fast to find theirs. A little later, we'll see what Dale Molnar found out. Joining us now for a live look at the weather is Colette Kennedy. We started the week off, early on we had those flurries that came through. We had some snow accumulating, and I think we're back down to basically nothing again.
Yes, I think we're kind of down to basically nothing. Getting into a quieter weather pattern isn't such a bad thing. I do have some areas with some patchy flurries, and that's kind of the bulk of what we'll see. So it's sort of nice to take a little breather as we go into the weekend in terms of the active weather. This is a look at your stats. So we should be close to 4 degrees for a daytime high. Today certainly exceeded that. And at this time of year, those few degrees actually make quite a difference, right? And are low on the mild side as well. In terms of our current temperatures, it's 4 for Chatham, Kent, Leamington, Windsor, all sitting at 4 up towards Sarnia as well. And what's happening is the cold front's kind of working its way through the lower Great Lakes area. We're going to see those winds shifting around to more of a north to northwesterly direction. And the more northerly they become, the more we get into some of the cloud cover and some flurries being picked up coming off of its lake effect. It'll be light in nature, but coming off of Lake Huron. So this is going to be kind of the trend, and it's going to be that cloud cover is going to be a little bit stubborn. So I think it'll become a bit frustrating this weekend in just a few spots because much of your neighbors will be getting into sun, and I'll show you the areas where that cloud will hang in there a little more. The broader perspective, though, as that front is going through and those winds will soon be shifting direction. So there's a little bit, and it's kind of a mix because of the temperature. Certainly more rain showers or very, very wet flurries in terms of what we see because some colder air aloft. This is in the overnight hours, and watch as I put this into motion. Yeah, a few flurries possibly even early in the day tomorrow for the Windsor area, and then I think we'll see that kind of clearing out and not worrying about it. But I want you to watch what kind of happens right through this area here. So, even London, but especially a little further west towards Strathroy, perhaps even over towards St. Thomas. But through this general area, Chatham, Kent, you're going to get a bit more of this cloud cover hanging in there. And that's not just Saturday, but looking ahead into Sunday. It'll shift a bit as those winds will shift how they're coming across the lake, but there's going to be this cloud deck that's going to just be a bit frustrating, or at least that's how I think of it. Better, though, back towards the Windsor area, we'll be seeing more sunshine, and further east, there'll be more sunshine. But that's how it goes when you live close to a lake. And as we look at your temperatures for the overnight region, or overnight hours, -1. But because of those winds, there's still a little bit of a wind chill factor. And again, for early risers, you're going to notice this for Saturday morning. And then I want you to see where the temperatures are going for tomorrow. So not like today, all right? They're actually closer to seasonal and what we'll see for those daytime highs. And there's a few of those flurries again in the afternoon, even hanging on for Sarnia. But for Windsor, it would be earlier in the day. Sunday, 2 degrees, kind of a mix of sun and cloud. We'll have the same kind of variable skies as we go into Monday. I keep looking because we had so many stretches of, warm air coming in November. I'm always looking ahead to see, is that going to happen in December? And I really don't see it. We get a bit of a warm up on Wednesday, but that's just kind of short-lived. We're closer to seasonal now.
Okay. Thanks, Ms. Colette.
You're welcome.
And it looks like the weekend won't be too terrible, at least temperature-wise, to go out and find yourself a Christmas tree. Dale Molnar did just that. We'll have more on his story next. If you want to buy a real Christmas tree this year, you're going to have to hurry. They're going fast. And as CBC's Dale Molnar reports, it's the pandemic that's pushing the sales.
Out at the Bastine Tree Farm near McGregor, Ovid Bastine has seen a 25% increase in sales compared to last year. He says last weekend set a record, and he expects to sell out this weekend.
Why do you think it's so busy? I think people are maybe anticipating a shutdown, so I think they're coming earlier to get just in case that does happen.
This couple are first-timers.
Why did you decide to buy a real tree this year?
This year because it's the first time we're not traveling anywhere because we can't go anywhere. So it's the first time we're going to be in our own home.
We had a hard time finding one last year, so we decided to come earlier this year. And I'm surprised that there's so little this year, even though we've come so early.
Hard to find. There's not many that I'm aware of out in the county, and I didn't see any lots in the city that were selling trees like in previous years.
Out in Chatham-Kent, the Puddleford Tree Farm sold out last weekend. At the Watson Tree Farm, the owner says half the customers this year are first-timers. He says it's COVID-related.
It provides an activity for families to do something at Christmas together. So many other activities that would normally go to are canceled or they can't go in person. And here they can go out and wander around and cut a tree, and it's something that a family activity that is, I guess, as a result of the COVID.
Lenore Langs gets her trees at Bastine's every year. This year it was tougher.
It wasn't what I was looking for because I wanted a 7-foot bushy Scotch pine, but I found a beautiful 6-foot, some kind of spruce.
Well, I got my Christmas decorations up at home, so I guess it's now time for me to find a real tree. Ah, here we are. I think I found the perfect tree. Charlie Brown would be proud. Dale Molnar, CBC News, McGregor. It's not a bad little tree.
I think we're all proud. That's beautiful, Dale. Thank you for showing that off, or maybe it's going to be something that's inside of our newsroom here. That is it for us today. Thanks again for watching. Hope you're able to enjoy the weekend. And for any more on any of these stories, go to our website, cbc.ca/Windsor.